You're listening to the Public Health Entrepreneurs Podcast with your host, Dr. Charlotte Huntley. Greetings, everyone, and thank you for joining me on this episode. Welcome to the second episode of the Public Health Entrepreneurs Podcast. Now, if you missed the first one, be sure to go back and check it out as well. The purpose of this podcast is to explore topics of interest for public health professionals at this intersection of public health and entrepreneurship. My name is Dr. Charlotte Huntley, and I'll be your host. I am a public health entrepreneur with well over 20 years of experience in healthcare and in public health, and I've supported many other entrepreneurs along the way. This is a new podcast, but I've been podcasting for a while now, since 2017. We will be exploring all sorts of topics around getting started, finding clients, leads in marketing, offers and sales, as well as systems and productivity to help you strengthen your confidence and grow the business of your dreams. There's a little something for everyone here. So whether you've been in business for a while or you're just getting started, you'll find some helpful strategies and tips in the episodes that we publish here every week. I invite you to follow or subscribe to our podcast right now in the app that you're listening in so that you won't miss out on any of the new episodes. Now, if you happen to miss the first episode, I strongly recommend that you check it out because I answer the question, what is a public health entrepreneur? And it's a perfect segue into what we're discussing here. The first episode and this episode will go very well together, so you may go back and forth between the two. I'm often asked the following question, which we'll focus on answering in this episode. What is a public health consultant? It's a great question, and I receive it all the time, so I'm excited to dive into it right now. A public health consultant is a person who's an expert in a particular area of public health who works with individuals or businesses in their area of expertise. So consultants may advise or provide training to clients or actually do specific tasks or project work for their clients. Consultants typically work on a contract basis until a particular need has been met. There are three things to remember when you're thinking about what it means to be a public health consultant. There are multiple things to remember, but I've narrowed down to three to make it bite-sized and manageable. So the first thing is there's no one size fits all. Does that sound familiar? Public health is broad. Consultants may serve in any number of ways and any number of different niche areas, such as policy, advocacy, epidemiology, research, evaluation, administration, environmental, and so on. We will occasionally have guests on this podcast to discuss their consulting businesses to provide you with some real life examples of what's possible as a public health consultant. The next thing I want you to remember is that public health, as a public health consultant, it's an example of an entrepreneur. So I want you to stick closely with me on this one. There are multiple examples of public health entrepreneurs. Consultants are just one of those examples. All public health consultants are public health entrepreneurs. However, not all public health entrepreneurs are consultants. Are you following with me? Make sure that you listen to episode number 1, where we discuss public health entrepreneurs more specifically. Here's the next thing I want you to remember. Public health consultants are problem solvers. As consultants, we are solving the problems that our clients have with the solutions that we offer. We provide expert guidance or advisement. We teach them how to do something. For example, you create or provide training to a company or a team or department within that company. We can also do it for them. For example, an organization may contract with you to do research or analysis or generate a report. Those are just a few examples or the few things to keep in mind when you're thinking about what it means to be a public health consultant. So let me just quickly recap. A public health consultant is a person who's an expert in a particular area of public health who works with individuals or businesses in their area of expertise. And consultants may advise or provide training to their clients or actually do the specific task or project work for their clients. Consultants typically work on a contract basis with a particular client until that need has been met. Now, the three things that I want you to remember that I mentioned earlier when you're thinking about what it means to be a public health consultant is that, number one, there's no one size fits all. Number two, public health consultant is an example of an entrepreneur. Public health consultants are problem solvers. That's number three. All right. Thank you so much for tuning into this episode. You are now a part of the Public Health Entrepreneurs podcast family. And I am asking your help as a family member. That's how we do it in families, right? Help us spread the word about this podcast. There are 3 easy ways to spread the word. I say 3. I like 3s, right? I'm trying to make these things bite-sized for you. So there are a few ways you can do it, actually. If you're listening to the podcast right now in a podcast app, you can use the sharing buttons and just share this podcast with your network, someone that you think would be interested, or just share it broadly through social media. Another way that you can do this is share our website, publichealthentrepreneurs.com. And then also another way is to spread the word about this podcast by leaving a favorable review in Apple Podcasts or rating the show in one of the other apps that you may be listening in. Whichever option you choose, thank you for helping us spread the word about this podcast. I'm excited to get this going. I'm excited to finally get this idea off the ground and to jump in. Some of these episodes are just going to be foundational, bite-sized things that I'm answering questions that people have been asking. And then we'll do a deeper dive into some other episodes where we'll do a little bit more coaching style. It just kind of depends on what questions surface for me. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. Visit publichealthentrepreneurs.com to learn more.